guys, today we're talking about sign language for screening for influenza and COVID. A lot of the symptoms are similar, so we're going to talk about those signs and symptoms and how to sign them to improve the communication with your patients right after this. Welcome back. My name is Tammy and this is Nurse Minder, and on this channel we do everything nursing. So if you're new here, consider subscribing below so that you get the next video when it's released. Welcome back. So some of the common signs and symptoms for flu are similar to those of COVID, and we're asking a lot of these questions at the screening site. But here's the problem. At the screening site, I have a mask on, which makes it very difficult for those to use lip reading to help understand what's being said. So to minimize the challenges, we can do better. We will learn sign language related to COVID. One of the questions that we ask is about, do you have any difficulty breathing? Now, when you want to say just do you have, that's point, you, have, and that's really the question because you're making the question mark with your face essentially. And sometimes you can even just look at them and go have. So have is where you're taking the fingers of all of your hands, both hands together, like little choppy choppies, folding them in and bringing that to your chest. Have. Fingers are folded, have. Do you have? So do you have? That's the question. And now we're going to put in all those symptoms that we've been asking people at the screening station so that we can really understand if they truly are symptomatic or asymptomatic for flu and COVID-like illnesses. Difficulty breathing. Difficulty breathing is a combination of two signs. One is difficult or hard, and the second is breathing. So breathing, you take your hands, both hands on your chest. Take both hands on your chest and you move them in and out, just as if your lungs were expanding and contracting. Breathing, breathing. Now difficult, hard is the same symbol. You're going to take the index and point your finger of each hand, bring them down into like rabbit ears, bent rabbit ears. Turn them to the side, they're like little claws. Turn them to the side so that the knuckles are rubbing against each other. And this would be hard, difficult. So I want to put those two things together. Are you having any breathing difficulties? Cough. We're going to take the letter C, turn it on its side, and bring it to our chest. And we're going to move it up and down a couple of times, while at the same time mimicking a cough with our face. Now there is another way. So the first way is this one. The second way is to take the open palm and brush it away from you as you make the coughing look on your face. Now you can see that when I have to put on a mask, I lose that from my sign. So it's important that our eyes are also coming down. In order to help increase the communication. Fever. Just like you would at home when you're feeling hot and you go, oh, you feel my forehead, I must be hot, I must have a fever. It's the same thing in sign language. Just put the back of your hand on your forehead. Fever. Now there is again another sign. The regional differences with sign language, just like there are dialects in our language. So the first one is fever. And the second one would be two index fingers rubbing against each other and to indicate that it's high. High temperature, high temperature, high temperature. So anyone asks, do you have a fever? chills, this is for cold, and you shake as if you're literally shaking because you're cold. Now another thing we ask about is sore throat, runny nose. So for sore throat, we're going to actually use the symbol pain and hurt, and that's like our 2 index fingers pushing together and twisting, and again the face. And then we want to either point to the location, my throat hurts, or we can put this at the location and indicate that the pain is at the throat. Similarly, if you had a headache, just since we're on pain, headache is another sign that we ask for. Runny nose is you're going to take your 4 fingers, fan them out, and move them back and forth underneath the nose to illustrate the drip, 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 right? Runny nose. Vomiting. Notice my shoulders hiking, that look on my face, and what we're doing is we're fanning out our fingers as if we are actually creating that wave of vomit. And then diarrhea is an offshoot of poop. So if we were to pretend that this is your sphincter, this is poop and it's inside your bum, okay, so this would be poop when it comes out. That would be normal, poop. But we want to talk about diarrhea. So we're actually just going to open up our palm a little bit, fan these fingers out, and we're going to rub it many times. I hope this helps you really with your communication with the patient population as you serve them. In the future videos, I'll be talking about some of the questions we're asking about like travel and being around people who are COVID positive or being tested positive for COVID. So watch for that. And until next time, make it a great day. And hey, by the way, why not pick up your Nurse Minder gear? You'll find the links here on the channel and become part of the Nurse Minder Nation. Hey, I know you're probably not ready to get off your phone or go back to work just yet, or maybe even turn the lights off to go to sleep. So why don't you spend a little bit more time here watching another video?